So my name is Cecilia Benoit. I'm a scientist at the University of Victoria. I work at the Canadian Institute for Substance Use Research, and I'm a sociologist as well, but I'm retired from that position.
So, can you tell us about yourself and your work to better understand the role of the social determinants of health in marginalized communities in Victoria?
So I'm a sociologist. I'm trained as a sociologist, so that looking at the social connections and social in society has always been something that I've been very interested in. And so the my work from the very beginning, my research has focused on the social determinants of health, especially around um, the health of pregnant women and birthing women and women in both Indigenous and non-Indigenous communities. So I was very interested in not just their physical health, but also the important role of others like the midwife, for example, and family in the social health of pregnant and early parenting women. And similarly, other research I went on to do in relationship to street involved youth, to people who work in sex work, uh, and um, and just women workers in general. I've always been interested in the determinants of their health, the social determinants of their health, and the important role of the problems that's created by social isolation and loneliness in industrial capitalist societies.
So, we have often heard about social determinants like access to healthcare, financial security, and education, but we have not really heard about the role of connection and community until the global pandemic. Why do you think that is?
I think some of the main reasons why that is the case is that concepts such as access to healthcare, financial security, and education are easily measured, and they're more individual concepts or individual determinants. They're caused by structural factors, but they so you can we actually know how to measure education formally, and we know how to measure financial security and so on like that. But social connection and community are by their very nature complex, and so they involve more than individuals do. Individuals relating to each other's, and then when there isn't connections, then it leads to loneliness and isolation. So it's more difficult to actually study it, because it's less immediate, more like distal, people have not been really focusing on it nearly as much until we have these crises like the global pandemic. But also it happens in other situations when there are disasters or other things happen, and we realize that the social glue in the society is actually really important for keeping people healthy. Yeah.
And how important is a sense of connection or belonging to someone struggling with the fundamentals of life or trying to overcome a challenging period?
I think they are extremely important. I remember way back when I was a student of sociology, and I read a book by Norbert Elias called The Loneliness of the Dying. And so he was focusing on aging and dying and in modern societies where the village or the community family had people when they get older, or when they are adults, are now separated from, or often separated from. And so when people get ill, or when they age, or something happens to them and they're all alone, then it really has a major impact on them. So I was thinking about that very, very early on in my career. And so having those connections or feeling belonging, even if you don't have a lot of wealth, or even if you don't have all the assets you'd like to have, it can make people happy, can be enough to create healthy mental health and social health for them. So it's extremely important. And of course, we need the other determinants as well, but we can't forget that this one is extremely important. It starts from the very beginning. Children, when they're born, they would not thrive or survive, but thrive without a strong kind of social connections with their mom and dad and others in their family. And I think it goes all the way through. And one of the real crisis I see here in Victoria or Vancouver and BC, but in general in Canada, is the disconnection, loneliness, isolation young people, people in their young adults into middle age, especially young men, and that I think is one part of the reasons for the drug overdose and the kind of death on necessary deaths that we're experiencing. Um, tremendous number of them per year now in the last while. Yeah.
What role do you think the GenWell Project can play in raising awareness and intentionality around social health in Canada? And what might be the longer term impact of that knowledge on marginalized communities?
Well, I think that because it's national and also has international connections, but because it's national and because it's squarely focused on social connection and overcoming like isolation, and it raises it too as an important determinant comparable to the other determinants, and puts it on the radar of governments and of ministries of health and others, and we have the potential right now at GenWell to coming out of the pandemic to keep that focus um, squarely on the importance of social connection. And so I think it's an opportune time to bring home, that this should not disappear, this focus, but it should be very central, one that it's really important for the general population, but it's especially important for marginalized groups. So the one I just mentioned, or the street involved youth that I have been studying, others who are more more isolated in our society. It's extremely important that we keep the focus on social connection and find ways to help those communities. And it could be elderly people in isolated in their homes. It could be people who we don't really know about, but because they're hidden in the social structure. Yeah. So I think the organization has a really strong role in capturing the interest now and keeping it going as a really important issue. And it can actually help save lives and can make people's social health a lot better, especially for marginalized people.
So, how did you manage the disconnection during the global pandemic? And what do you do to stay socially connected these days?
Um, well, before the pandemic, I was always someone who um, exercised, every day. Either I went for a run or I would go for a walk and so on. But mainly relied on connections by going into places, like into the institute where I work. So I talk to colleagues or having guests, family and friends over to my houses. Those were not able to do during the pandemic. So I shifted. I started to meet my friends outside and going on what came to be like weekly walks. So we would book those in our schedule, rather than meeting in cafes or meeting in houses and so on. And so I actually have kept those going, even though we don't no longer. And I've even rekindled friendships that I didn't have routinely before. And so now, so in fact, the pandemic has allowed me or encouraged me to be outside a lot more and to meet friends outside and to be with them as we move through the community, as we walk through different parts of the city or go for runs and so on. So it's really helped me. And the other thing I did do during the pandemic is I did use social media. So I used a messenger routinely to chat with grandkids who were not in town, and we would talk often for hours, and we had a way of reading books together and stuff like that. So that was very useful. And then my siblings live in Newfoundland, so that's the other side of the country. And there I use Zoom for have family meetings or family chats. And we still do that. So in a way, some of the technologies were really useful and are still useful for connection, but also just the physical world. I learned to get out in it more and to enjoy it more and to have friends with me. And of course, when you're out there, you also meet people and you're able to say hi. Hopefully you make their day a little bit better. Yeah.
And you have spent a lot of time studying in this area. So, what would you say are your three best tips for those needing help getting or staying connected?
Well, I think if we could start your day with some positive thoughts, just things that you could um, um, just feel good about, whether it's about yourself or about other people. So try to start your day in a positive way. Organize, organize your the hours so that you get outside a couple of times. So have some activities to do, and it could be your routine like shopping or something like that, or it could be going for walks with friends and so on. And but try not to always be by yourself in a car or something like that. Instead, like take the bus. I take the bus all the time. I think it's great. If it's too far to walk, and then you have a chance to meet people. People say hi to the bus driver. You interact with people. So I think it's really important to do some outside activities. Get out of your shell. Get out of your home, your workplace, and try to get outside, or for a lunch break or something. The third one, which is I think really the hardest one, is to try to work on your prejudice, on your assumptions about other people, on your judgments about other people. So I think we're all conscious that we see someone and we judge them right away, and then we don't say hi to them or we don't interact with them. So try and think about making yourself when you feel uncomfortable. It's a really good time to try and check why you're feeling that way, and perhaps be able to change up some of your feelings about other people so that you feel that you can connect with them. Find some reason to connect, some way to connect, and then that would increase your sociability with them and reduce your isolation, but also hopefully bring them into connection as well. One thing that I do on a monthly basis, which is a hard thing to do, but we've done it, is I'm myself and some other people, we go to the homeless shelter and fix people's bikes for an hour and a half. And so I'm the intake lady. And so they come up and give me their name and tell me what's wrong with their bike. And I give them a little number. And in an hour and a half, we chat with a lot of people and they tell us their life story. Meanwhile, we try to fix their bike, and then we go, right? But every month they know we're going to come. So I could have a lot of, fears and everything like that, but I put them all aside, or I try to, and try to, relate to people there to get their bike fixed and tell me their story. So yeah, so really, it's very hard to do that, but I think that is really important, because otherwise, lots of people will remain lonely and isolated if we don't try to see how we connect rather than how we're different. Yeah.